Nursing home residents are among the most vulnerable when it comes to the coronavirus, with more than 68 deaths nationwide. But the numbers may be much higher. That's because New York is not counting deaths from nursing homes if the patient is transported to a hospital and dies there. Despite criticism for that, New York Governor Andrew Cuomo says New York has only 20% of COVID deaths from nursing homes, compared to 68% in Pennsylvania, 64% in Massachusetts, and 44% in New Jersey. Fox News' Janice Dean is critical of the state's overall handling of the crisis with the elderly and nursing homes. She spoke with our Charlene Aaron about her family's heartbreaking story. Take a look.
It was months and months and months of agonizing decisions on what to do with our aging parents, my husband's parents. They were getting to the point where they couldn't take care of themselves. They couldn't take care of each other. They were living in a 4-story walk-up. His mom couldn't walk. His dad had dementia. So this was a decision that was very tough to begin with. We finally found a assisted living residence that was going to take both of them, despite Mickey, my father-in-law's dementia and his health issues. But it was close to our house. But what we had to do was make sure that Mickey was in better shape. So he was in a nursing home for rehab. And his mom was in the assisted living residence in a double room waiting for Mickey. And then coronavirus happened, like literally just a couple of months when we made these decisions and made the move for them. We hadn't even cleaned out their apartment in Brooklyn. So coronavirus happens. We're not allowed to see them. We didn't know his dad was ill at all. We were getting updates from the nursing home, regular updates. And one Saturday morning, we get an update the end of March saying, your dad's not feeling well. And 3 hours later, they call us back and tell us he's died. His mom was in the assisted living residence. She was in better shape mentally. She could tell us what was going on in her assisted living facility. She was worried that people were coming in and out and they didn't have masks and they weren't washing their hands. And so we were getting concerned about that. My sister-in-law was calling every day saying, listen, you got to get your act together. This is not acceptable. And several days later, she got ill, and she had to be brought to the hospital, and they diagnosed her with coronavirus, and she just, died a few days later. So separate facilities. And because of New York's bizarre way of counting deaths, they don't count the deaths that happen in the hospital, even though my mother-in-law got the coronavirus in her assisted living residence. And to me, that's a sign that they're trying to hide the numbers.
What's your response to the fact that they're not, releasing, they're not disclosing how many nursing home residents have died?
Well, that's why I'm speaking out. I would have never done this normally. My husband can't even bear to watch any of the interviews that I do or any of the, written pieces that I've written. It's too hard for him. But the reason he's letting me speak out is because we weren't seeing any coverage of this. These interviews don't get any easier. But if it makes one family feel like they're not alone in their grieving, then it's worthwhile.
You want to see a full bipartisan investigation into this issue. What do you hope? What's your hope that will happen? What do you hope comes out of it?
Listen, the fact that he doesn't want one and says there doesn't need to be, the investigation they conducted here in New York was by the Cuomo administration into themselves. And they found no wrongdoing at all. And they also said that it wasn't the coronavirus patients, 6,000 of them, that they put into the nursing homes. No, that had no effect at all. It was the nursing care workers and the visitors, apparently. And I'm telling you right now, we were not allowed to visit my in-laws during the pandemic. So
that was very well known. Everyone knew that you couldn't visit people in nursing homes.
Right. So that was his investigation into himself. So why would he need another investigation? My argument is, if you have nothing to hide, then why wouldn't you welcome any and all investigations, especially one that's bipartisan? This has nothing to do with Fox News or being Republican or Democrat. I mean, all these families, the families that I saw testifying, I don't know who they voted for. It shouldn't matter. So that's why I'd like a federal hearing. I would like a 9/11 style commission hearing, because it's not only New York. There are several other states that did the same thing, putting coronavirus patients into nursing homes. So, listen, that's my hope. I don't know if that'll ever happen. But my argument is, Governor Cuomo, what do you have to hide?